Okay, welcome everybody. Thank you all for joining us today. I hope everybody got some coffee and some breakfast, some fruits and yogurt and bagels. I'm Kimber Bogard. I'm the Managing Officer of the Culture of Health program, and I want to welcome everyone here today, so thank you. You are joining the very first stakeholder meeting, which is part of the Culture of Health program here at the National Academy of Medicine. This program is in partnership with the Robert Wood Johnson Foundation, who actually had the foresight to create a 5-year program of activities with the National Academies to conduct a series of consensus studies, stakeholder engagement activities, and communications efforts to combine science, research, policy, and practices with stakeholders in each of those areas, and also identify folks working in those areas, but across sectors. And the whole goal is to continue to contribute to the movement to create a culture of health across America. And the focus of this work over these next few years will be on health equity. And our first study that was released on January 11th was conducted by the National Academies of Sciences, Engineering, and Medicine, the Health and Medicine Board, or the Health and Medicine Division, and it focused on community solutions to achieving health equity. You should all have the highlights in your packet, and there's a lot of additional materials outside. And you'll be hearing from some of the committee members today about the findings and recommendations from that first report. So there are several objectives that we aim to meet here today as part of the Culture of Health program at the National Academy of Medicine. But in some, we aim to create a movement across the country to move the needle on health equity with partners like you, who work in many different sectors and disciplines and approach health equity from many different lenses. I want to acknowledge those on the webcast. In addition to those who are here in the room, there were almost 300 people who registered for the webcast, so we want to say hello, welcome, and I think they're all connected and engaged with us here today. They will be submitting their comments and their questions also through webcast when the webcast screen is up, and we'll be able to see those and actually engage in a dialogue with them as well throughout the day. So we want to make sure that they're just as much as part of the discussions as we are here in the room. So we're really grateful to have everybody here and on webcast to help contribute to our thinking on how to move the country towards creating the conditions where everyone has the opportunity to attain their full health potential. The discussions today will serve to inform our next consensus study at the academies. There will be a series of studies. As I mentioned, the first one was just released. And we will take all the comments and input into consideration that we hear today with our advisory committee, several of whom are here in the room. And you have the list of the advisory members on the backs of your agenda. And we'll also be discussing this and engaging the Robert Wood Johnson Foundation to determine this next big study. But in addition, we'll also have several resources for you to use to communicate the science on health equity and to advance the policies and actions across the nation that are necessary to move the health equity agenda forward. So a little bit about the framing for today. You will hear from many different perspectives, as you've probably noticed on your agenda. And this is the folks speaking here today all work tirelessly on behalf of issues related to health equity. The format's going to be a discussion format with few presentations. The presentations we have will be very brief. The speakers will have more time in this format to actually interact with the moderator and with the audience and with those on webcast. The perspectives that we've pulled together today actually identify social determinants of health, and they are going to be identifying some levers in the community to advance health equity. So everyone needs to contribute to this discussion. Every voice is important, and we want to encourage you to do that. We'll have early career voices here, as well as those who've worked for decades on equity and justice. So there's a recognition that it will take all individuals and institutions from many sectors to advance this agenda. So we have therefore invited voices from government, private industry, philanthropy, research and academia, the military, and storytelling to discuss with us and with each other about how they can address health equity. So many of you in the room and on the webcast are also working day in and day out to improve health equity in the nation. So therefore, your voices are important that we want to hear as well. So we'll have very short discussion periods, as you may have noticed on the agenda, but there are many opportunities for you to share your opinion, share your work with us. Ivory, who's on my team back there, will be conducting Poll Everywhere, which is an online poll. She'll be asking questions. You'll be submitting your answers and responses and comments, and everyone in the room will be able to see those. And we'll be doing snapshot videos during breaks, during lunch, after the meeting as well. So we'll want to capture your ideas and your work in those videos that we can then post on our website and keep sharing the knowledge. So we're here today to not only bring you into the fold of this diverse group and to continue our dialogue together over the next several years, but we're here also to learn and to exchange with each other. So together we aim to be greater than the sum of our individual parts. So I also, should tell everybody, just for a logistics issue, if you need to use the restroom, it's out the door to the right and to the right. Again, very short breaks. Feel free, to get up and do what you need to do, or get additional coffee or water, anything like that. I'd like to recognize our advisory committee, the study committee, and the staff, including our internal academies team for the Culture of Health program, who work really closely with me. And that would be Ivory, who's back there. She conducts some research support for us. We have Charlie, who's here. Charlie will be keeping time. And for those who have the little light box in front of you, we have a green light saying you're good to go, yellow light, you got 2 minutes left, and red light, you need to cut it off. So we'll have very strict timing for our session, so we're just respectful of every single speaker, and every speaker has the time allotted that we had prepared for. We have 6 of our advisory committees with us today, and they will be moderating the discussions throughout the day. And we have some committee members here. So we have Allison Evans-Kayar, we have Helene Gale, and Rob Duggar. Although I'm not sure if Rob Duggar showed up yet, but they will be arriving today, and they are on the agenda. And we also have folks from the community who actually provided their perspectives to the consensus committee about their models that are addressing one or more social determinants of health in their work. And so I really hope that you get the chance to meet these folks and share your work with them as well. But I really want to recognize the Robert Wood Johnson Foundation, who had the foresight and the ingenuity to develop this program with the National Academy of Medicine and the broader National Academies of Sciences, Engineering, and Medicine, and to advance this agenda on health equity. Today we have Jim Marks, we have Dwayne Proctor, and we have Kim Elliott here with us today. So again, I hope you have a chance to exchange with them. And finally, I'll just highlight a few themes to keep in mind as we're going throughout the day that you'll be hearing. As you heard already in my remarks, we're going to be engaging in cross-sector dialogue. We'll be having a focus and highlighting some of the social determinants of health. We'll be discussing how to engage communities in a very meaningful way. And we'll be focusing on building off individual and community assets and strengths to move toward creating the conditions that maximize opportunities for everyone to reach their full health potential. So thank you all. And I'm going to now introduce our first speaker, who is a storyteller, and his name is Adam Booth, and he's from Appalachia. I just learned how to say that the other day, so I'm pretty proud of myself. He is a words artist and a musician, and his storytelling blends traditional folklore, music, and an awareness of contemporary Appalachia. His original voice, which is humorous and touching, as you'll all see, is influenced by generations of diverse storytellers in West Virginia. I'll be reading very brief comments about each speaker. You should have full bios in your folder and in the Dropbox online. So I encourage you to read thoroughly the bios of the people with very rich skills and experiences that we've brought here today. So thank you, and Adam.